Hi, my name is Tanisha Cajas, and I'm going to talk about urinary tract infections in older men. Definition: a urinary tract infection (UTI) is an infection in the urinary system which includes the bladder and urethra. Urine infections also affect men, despite the fact that the prevalence is lower than in women. In men, the treatment is usually longer. Symptoms and causes can specify that men and women are different.
A urinary tract infection, or UTI, can occur in any part of the urinary system. Women are more likely to get one than men as their urethra is shorter, which means any bacteria has less far to travel. Dark, smelly urine is not a sign of a UTI, but it may indicate that an older person is becoming dehydrated. A dipstick urine test is not an accurate way to test if a person aged over 65 has a UTI, because they are far more likely to have bacteria in their urine already. This can lead to a false positive test result. A daily fluid intake of at least 1.5 litres may help to flush the bacteria away and reduce the chance of a UTI. A suspected UTI should be based on clinical signs and symptoms as per national guidance. Run through this checklist. Does the older person have 2 or more of the following as new symptoms? Confusion, agitation, drowsiness, or worsening of these conditions. Shaking or chills with a high temperature above 38 degrees C or low temperature below 36 degrees C. Painful or difficult urination. Needing to go to the toilet quickly. Needing to go to the toilet more often than normal. Incontinence. Blood in the urine. Correct diagnosis and the prevention of UTIs leads to improved quality of life, reduced hospital admissions, and reduced use of antibiotics.
Applications in medicine. The most common bacteria in UTI are Escherichia coli, responsible for 80% of cases, Staphylococcus saprophyticus, Klebsiella pneumoniae, and Proteus mirabilis. Chlamydia or uroplasmas can colonize the prostate in young men of sexually active age. In those who already have an enlarged prostate, an emptying of the bladder is more inadequate. Generally, the germs that condition the infection are other bacteria, Escherichia coli, Klebsiella, and Proteus.
But it is a very common condition. I see it easily 2 or 3 patients a day with it.
Dr. Alejandro Miranda Sosa is a urologist on staff at Lee Memorial Health System. He says developing a urinary tract infection, also known as a UTI, is common for women.
A female having an infection once a year, once every 5 years is not unheard of.
A UTI is the presence of bacteria in the urine. Women have a shorter urethra than men, shortening the distance the bacteria must travel to reach the bladder.
So the most common is burning to urinate, frequent with urination, and usually patients notice the urine being a little cloudy or sometimes strong smell.
Typically, an antibiotic will clear the infection, but if it keeps coming back, health experts may decide to run a series of tests to find out if the infection is caused by something else.
There could be something anatomical. What happens? There's a stone, there's obstruction, there is something that is not letting the body clear the bacteria.
Other problems that could lead to a UTI are constipation, sex, and poor hygiene.
The elder population will be much more at risk. One is because of the barriers from the outset have been debilitated.
But for men, a UTI is not common and can indicate a more serious problem.
Most of the time it's prostate issues. Most of the time is a patient cannot empty the bladder completely. Stones is very common, so we need to explore that.
Man or woman, if a patient suspects they have a UTI, it's important they visit their physician. For Lee Memorial Health System, I'm Lindsay Fry.
The Planned Parenthood thing. We don't know how close you were following all that.
Pros and cons. Pros. There are no pros in this case. Cons: pain and stinging when urinating, impossibility of voiding, which requires the placement of a probe in the bladder. The duration of the antibiotic cycles is usually longer to ensure that the infection disappears.
Hi, I'm Dr. John Schufelt, the founder and CEO of MeMD. Urinary tract infections are responsible for more than 8 million visits to physicians' offices per year. Approximately 40% of women and 12% of men will experience at least one symptomatic urinary tract infection during their lifetime. Symptoms of urinary tract infections vary between men and women. However, there are common signs that can help distinguish the infection. If you are experiencing a frequent urge to urinate with small amounts of urine, a burning sensation during urination, cloudy or dark-colored urine, blood in the urine, foul-smelling urine, back and pelvis or lower abdominal pain in women, or penile pain or discharge in men, you should speak with a doctor. UTIs are common ailments for which patients request online consultations. During an online consult with one of MeMD's medical providers, you'll be asked a series of targeted questions. Be sure to mention if you have a past history of urinary tract infections, as it may change the choice of drug and length of treatment prescribed. Your provider will then discuss their diagnosis and the risks and benefits of various treatments. Your treatment plan may include a combination of prescription and over-the-counter medications. These can be e-prescribed through MeMD. Your doctor may also discuss the advantages and disadvantages of in-person urinary tract testing if symptoms do not improve. Please note, in certain instances, an in-person examination may include a urine test, a pregnancy test, a urine culture, and an ultrasound. If your doctor is concerned that your kidneys have been infected or there is a possibility of another important diagnosis that needs to be ruled out, you may be advised to seek in-person care. Thank you for your interest in MeMD. We look forward to helping you with your healthcare needs whenever and wherever.
Issue applied in Ecuador. If they have found verified cases about urinary tract infections in older male patients. Although, as the symptomatology of many urinary tract infections is less intense and acute, it takes longer to go to the urologist's office. Conclusion. To conclude, the most important prevention is the control and treatment of the condition, which is usually BPH in the adult male. In general, effective water intake 2 to 3 liters of water daily. Regular bladder emptying, urination every 2 or 3 hours, and proper genital hygiene are considered effective measures for the prevention of UTIs.
One of the most common infectious diseases that people come to us about have to do with urinary tract infections. And UTIs, or urinary tract infections, of short said, are very common infections, and they affect both young patients, and they can also affect an older population. It's a really simple infection to treat because, in general, with very few days of antibiotic therapy, you can really take care of the infection. And most of the time, or most of the physicians would also order some tests to be run, including a urine analysis and a urine culture. That will give us a better idea of what bacteria we're treating, and therefore we can attack it with the appropriate antibiotics.
Thank you for watching.